Protesters in central London are marching to Parliament Square demanding the government do more to tackle the cost of living crisis. Banners reading "Cut War, Not Welfare" and "End Fuel Poverty, Insulate Homes Now" are being carried by demonstrators and rally speakers, including Francis O'Grady. The Trade Unions Congress, the TUC, which planned the rally, says the workers have lost almost £20,000 each since 2008 because of pay that hasn't been keeping up with inflation. I'm joined now by Amaran Uthayakumar-Cumarasamy, London-based doctor and member of Medact's Economic Justice Group, who's at the march now. Amaran, good afternoon.
Good afternoon, Alexis. Thanks for having me.
Amaran, tell us, whereabouts are you now?
So I've just made my way off Parliament Square, just find a bit of peace and quiet and shelter from the rain.
And what's the atmosphere like?
It's incredible, Alexis. It's been so heartwarming to see thousands and thousands of ordinary people, workers, health professionals, patients of mine come out and really raise our voices about the ongoing squeeze on cost of living that's affecting so many people. So the rain clearly isn't going to dampen any spirits today. It's been really positive, and I think a really strong message has been sent.
Now, tell us a little bit about the people that you're there with, Medact's Economic Justice Group. What are you campaigning for on this march?
I've actually come with a range of different groups, Alexis. To be frank, I'm just here as a children's A&E doctor. I work just up the river. And really, I've come here motivated by so much of what I'm seeing in my own A&E department on the day-to-day when I'm, working on shifts with my nurses and doctor colleagues. So for me, this is about seeing so many of the kids turning up with exacerbations of their asthma, chest infections because of their poor housing, because their parents are having to make really difficult decisions about choosing where to spend the limited money they have available. I'm also here because I'm seeing a prolific mental health crisis amongst the young people that I see. Some really horrible stuff that's often related to the sheer inability of their families to be able to budget accordingly because their wages are not kept up with inflation. And the rent and bill prices are just simply not meeting their needs. And I'm also here, sadly, also for issues related to malnutrition and simply children who aren't able to meet the requirement of their nutrition to keep up with their expected growth and their development. We're seeing children being left behind, underperforming at school, precipitating further mental health. And as someone who works in the health service, this is really shocking stuff. So I've just come out here as a health professional. There's been lots of other groups here with very similar experiences and with similar demands and expectations of government. And it's been really important for us to try and voice our concern to both the government and to the public about what we're seeing in A&E and in the NHS on the day-to-day.
What do you want to see from the government going forward? I mean, the cost of living crisis, just to be fair to the government, it is not entirely of their own making, if you like. It has a lot of external devices that have come into play, the war in Ukraine, the coming out of the pandemic, all of these things. There are some aspects of it that are not really under the government's control. So what would you like them to do?
Yeah, I think there is some merit to that point. Certainly the conflict in Ukraine was unexpected, but I think it's important, given what we see within the health service, that a lot of the crises that we're seeing are simply the tip of the iceberg, and submerged underneath that water has been the growth and proliferation of this ill health and this crisis for many years, extending as far back as 2010. We've seen life expectancy go into reverse for the first time in our records, just as the pandemic was kicking off. So even before those very difficult 2.5 years started. It's also really important to also keep in mind that this is the biggest squeeze in living standards since the dawn of the peace era. And this was the same time at which government were able to mobilise their infrastructure and resources in such a bold and powerful way that they were able to create dramatic transformations in people's quality of life and health outcomes. So, for example, we know about the NHS, but also how that was built in tandem with social care, social housing, excellent provision of public services. So it's funny that not only is it about saying that government are capable, but historically we've seen in similar circumstances they are more than capable of meeting the demands and needs of people. And as a children's doctor, I can see how we're failing on such a level that really for the sixth richest nation in the world, it's really not acceptable, is it?
We were looking at a study just as we were talking about the show. Over half of UK people in this survey commissioned in the Royal College of Physicians reported that their health has been negatively affected by the rising cost of living. How are people's health being affected? How much worse do you think it's going to be getting? Because we have been told by the government, strap in, this is not going to be over anytime soon. At least until the beginning of next year, we are going to be seeing the cost of living crisis continue.
Yeah, I think it's deeply worrying, isn't it? I mean, I can speak from my experience as someone working in children's medicine, but what's particularly worrying is it's such a crucial part of their development as they become young adults and future adults of tomorrow. And these are years that you can't reclaim back as well. So what I worry about particularly is not only that stunting in growth, the missed opportunities for meeting education and success and thriving in exams, but also the mental health side, which is somewhat underrepresented. I think it's really important to acknowledge that when we talk about a cost of living, this is affecting working mums and dads, guardians and families, but it's children that will often bear the brunt of this. And whilst often they can be physically resilient, I think if this persists for so long, we will begin to see children in older age with chronic conditions that will only further add to the burden that's already on an under-resourced NHS. But I also worry about the mental health side as well. That both in the milder sense, in terms of the depressions and anxieties we see that have the potential to become worse, but also in the more serious mental health that we see in regards to issues related to self-harm, trauma, so on and so forth. So for me, it is deeply worrying. I can't see an end to it unless there is drastic, deliberate action taken by government who ostensibly are there for people in the interest of levelling up. I worry about how unequal society is becoming, and I worry about how these divides are widening and the fact that time is running out to be able to put in important interventions to stem these lost years for these children that I'm serving.
Amaran, before you go, you've been talking about, your job. You deal with children in your job, and I wanted just to find out from you whether some cases that you've come across. We've talked a lot about children living in poverty, and this isn't just children living in poverty in any old families. This is families where both parents are working, and we've seen that number rise. So in your job as a paediatrician, can you tell us what are some of the cases that you have come across and how you've noticed things getting worse in the recent times?
Yeah, I think that's a very good point. I think just one example that comes to mind is that as a doctor working in children's medicine, we're starting to develop a broad set of resources for our patients and for their mums and dads and guardians. So when they're having to, leave the A&E department, when they've been discharged and had the care that they've needed, we're producing resources that are directing them to food banks. We're directing them to legal aid. We're trying to support them in regards to rent evictions and the threat of having to move from home to home is having on their health and well-being. And you're quite right. A significant proportion of both single and dual parent families are still living in poverty, and it's really worth pointing out that. As we see so many households, families and children affected, the term poverty itself isn't always the most helpful because it's just affecting so many children. And it conjures up quite Dickensian Victorian ideas of sheer deprivation. But this is affecting so many people in myriad different ways. But the bottom line is, if we're not empowering ordinary people, ordinary families with the resources, income, public services they need, they're not going to not only survive, but thrive. And as one of the world's richest countries, we should be all standing up together and say we want our next generation of children to thrive. And right now, we're just not meeting those needs. And just as a caveat, if you excuse me, this is also a time where we're also seeing a range of corporations profiting in excess, record profits, at a time where we've seen a huge squeeze on the standards of living for so many people. So on one hand, this is a question about how we can mobilise government resources, but it's also an issue about redistribution and the issue of fairness. So many of these people have come out today really asking the question, what is fair and what is possible? The ideas are all there. It's really just a case of political will at the end of the day.
Amaran, thank you so much for giving me all this time. I really appreciate it.
No, that's an absolute pleasure. Thank you.
That's Amaran Uthayakumar-Cumarasamy, London-based doctor working with kids, as you heard there, in A&E, who is speaking to us from central London. There is a march heading to Parliament Square demanding that the government do more to tackle the cost of living crisis.